So you should do the blood draw sterilely. So I'm pulling up the anticoagulant. So Nala's like 70 pounds. So we're gonna do 51 mils of blood and 9 mils of anticoagulant. Yeah, so 60 mils total with the anticoag in it. It's by weight and how it all depends on how many mils of the PRP you want to get out. It's about 10%. They're going to talk in a second, but we're just going to go to draw blood so we can start processing while they talk. Can I get a 20?
And you wouldn't have to do 9, but 9 is going to give you about 4 hours to work with.
Okay.
So it'll stay. It's going to stay
Right.
stable for longer. So you could do 5 if you wanted.
Okay.
It just is going to be a little bit less stable.
I see. Okay.
Turn you around.
Okay. You're good to sticker?
ACDA.
It's ACDA. No, ACDA, right? ACDA.
Yep, yeah, it's-
yeah,
yep.
ACDA.
We can always we can stop at any point, and what we can do is readjust the weight of the counterbalance.
Okay.
So if you feel like you're done,
okay.
we're good.
Yeah, I think we're done. This should be.
Pour it down the sides if you get it all the way in there.
It's just meant to keep it from splattering or getting foamy.
Okay. So slowly push on this one.
Yeah, that's good.
Perfect.
Okay, catch you up. Here's what we just did. Sterilely, the person that's drawing the blood, we put a butterfly needle into the jugular vein. We used a sterile syringe to draw 60 mils for this patient. And then the person that draws the blood has sterile gloves on, takes the needle off the syringe, puts a dispensing needle that looks like this on top, and then that fits directly into this tube and pours the blood in without creating any foam and bubbles. And then you put the green top and then the clear cap on there.
And then you weigh it.
And then we'll weigh it. And it's 96, I assume that's grams.
Yep.
So, perfect, 96. And then roughly how many mLs do you see in there?
It's 51.
Yeah. So this is the counterbalance. You'll create this one time and then adjust the volume of water inside of it. With the cap on, we're going to weigh this.
What are you at?
93.5.
Are we at 96?
We need a little bit more water in there. So
How close do you need them to be together again?
within a gram or two.
Okay.
Right? So the next step would be to take the whole blood and the counterbalance that are within roughly a gram and put them inside of the centrifuge. If we were doing a 120 draw, which you would never really do for a small animal, mostly equine, you would have just 260 mLs in there, not using the counterbalance. So at this point, we close the lid, that locks down, and we are looking for, if you can see that on there, but 10 minutes at, we're in RCF, at 3,800 RPMs, and then we press start. So that is going to slowly speed up. Once it gets to 3,800 RPMs, it's going to start the countdown from 10 minutes. Once that's done, it will slowly speed down, and it won't come to an abrupt stop because we don't want to mess up the buffy coat. And then the top will open, and we'll take our blood out and proceed.
Okay.
Okay,
Okay.
so I'm going to inject a Stifle today, and my landmarks for this injection, we're going to go on either side of the patellar ligament that runs across the front of the joint. The location for the injection is going to be halfway between the patella and the end of the tibia, and we're going to point the needle pretty much straight from the side of the ligament towards the middle of the joint. So between a 45 and a 90-degree angle. You can put them in dorsal recumbency or do it laterally and have someone hold the leg up and flexed. And when you flex the knee, it's going to open the joint to allow to get in there easier.
Okay, and then what do you usually experience when you're injecting PRP and stop?
As soon as you get resistance, because what you don't want to do is overload the joint capsule, put pressure on that. That's going to be painful.
Yeah.
So as soon as you feel resistance, you should stop. And the amount you can inject is going to be dependent on how much fluid is already in the joint.
Yeah.
And how much space.
Okay. And if you know if you do get something on there, you could just dab it down with some alcohol.
Yeah.
So the next step. So here we've got your red blood cells, really nice looking buffy coat right there, and this is your plasma, and the platelet-rich plasma is right above the buffy coat, and the rest of this up top is platelet poor plasma.
Okay.
So we're going to use the concentration device. We'll set it in the benchtop press. Exactly. And once that kind of locks in
At the top.
then we take the 60 ml and we're going to use this to push out the platelet poor plasma. And of course that was pre-primed. So we were talking about 60 mLs gets you about 6.5
So we've got
mLs
about
of
5 probably.
Yeah. So we're gonna, the 6 is right up there. So we usually bring the buffy coat right, I'm going a little bit slowly here, but right up to the 6. But we're gonna go past that just a smidge.
Okay, because we had less than 60.
Yeah. So, and by doing that, we're gonna get a higher concentration of platelets
Right.
in that 3 or 4
In the
mLs that
volume.
we get. There we go. We'll just leave it at that.
Okay.
So at this
So
point,
this is all platelet poor plasma.
yep, this is your platelet pour,
Okay.
and you just cap this off
Okay.
and dispose of it. Or if you're doing a protein concentrate, you would
Keep it.
keep it and then use that to filter down for your protein
So then
concentrate.
I'm gonna do. So just put that on.
Yes.
Do you have
And just
to
and you
spin
actually
it?
just push
Yeah.
down.
Oh, okay. So,
It's, so this is kind of the magic of it. The reason you don't have to do a 2 spin is
Uh-huh.
because we're pushing it instead of trying to
Oh, right.
take out the red blood cells first. So you can see the buffy coat kind of start to slide up
yeah.
the cone there, and we're gonna stop when we get the buffy coat in, or when we see the like a little poof.
Oh, yep.
There it is. So this is a leukocyte poor sample. If we wanted a leukocyte rich, we would just turn it a little bit more until the buffy coat goes in there. It looks kind of a booger going in there, and then you're done.
Okay.
But it's going to be more.
So I
of a-
should take this off.
Take that off?
Because I want it to say Sarah.
and then put one of those other red caps on,
Okay.
and then just gently mix it around, and now you're ready for injection.
Okay. Cool. All
With
right.
the needle 1st?
Mhm.
Okay, cool. You want to wipe there?
Yeah. 22, 1.5 for the stifle. All right.
I'm going to go ahead and.
I do miss doing joint injections. That little spin just brings back fond memories.
Doesn't have a lot of fluid. I'm definitely in. Don't have a good spot, Garrett. Sorry.
No, you're fine. She's gotta get that needle in there.
You might could come over here too, so.
Yeah.
You may have some scar tissue in there. It's pretty hard to get a
Yeah, that's what I'm worried about.
So there was a small mass on his left chest that was like a bleeding.
There you go.
And we've got no resistance. is an empty joint.
Pressure.
No pressure.